Wearing face coverings, physical distancing, and not shaking hands are now part of the new normal due to the global COVID-19 pandemic. The coronavirus is equally affecting health systems and economies in a strenuous and unique way. Hello, I'm Linor Moudou. Welcome to this special edition of Straight Talk Africa. In just 90 days, COVID-19 has infected about 100,000 people across Africa, but it took less than 3 weeks for the number of infections to double. Overall, more than 250,000 have been infected with the virus in Africa, and over 115,000 have recovered, according to the Africa CDC. Worldwide, at least 8 million people have been infected in the past few months. That's according to Johns Hopkins University. Although the full impact of the pandemic may not be known, many observers say the outbreak is overstretching already weak health systems in African countries, and the economic impact of the health crisis is also estimated to be severe. To what extent is the coronavirus pandemic affecting Africa on the socio-economic front? What will it take for the continent to overcome this crisis moving forward? Today, our experts will help answer these questions. But first, as African countries gradually reopen after weeks of lockdown, governments are looking to revive their sagging economies, which came to a grinding halt due to the restrictions. People are also excited to return to their normal activities. Straight Talk Africa's Paul Ndio has more.
It is likely too early to know the full impact COVID-19 is having on Africa. The World Health Organization and the Africa Centers for Disease Control and Prevention have issued guidelines for governments that opening up their economies too quickly could trigger a fresh wave of coronavirus cases on the continent. But the relatively low numbers of COVID-19 cases reported so far is raising hopes that African countries may be spared the worst of the pandemic. The WHO says the disease appears to be on a different path in Africa than in other continents. And so far, Africa is not experiencing the high mortality seen in other parts of the world.
We also see increasing numbers of cases in Africa, Eastern Europe, Central Asia, and the Middle East. Even in countries that have demonstrated the ability to suppress transmission, countries must stay alert to the possibility of resurgence.
Despite the relatively low death toll, the United Nations Health Agency says that the pandemic poses a major threat to the continent. WHO modeling predicts that if containment measures fail, even with fewer cases requiring hospital treatment than elsewhere, the medical capacity in much of Africa is likely to be overwhelmed.
It's not surprising at all that any country coming out of a so-called lockdown can have clusters of disease, re-emergence of disease in clusters. That's not necessarily a second wave. That is just a result of, many of you as journalists have asked us, there is a careful balance to be struck between keeping everyone at home and continuing to completely suppress transmission of COVID-19.
Violent protests against coronavirus curfews have flared up across major cities in Africa, while schools and businesses in some nations are slowly reopening their doors. Across the continent, the COVID-19 pandemic is strongly impacting the media.
We are covering COVID from, I would say, two angles. So the one aspect is, where you get these statistics from the health experts, from the Minister of Health and others in charge of giving out information. I've seen journalists, focusing on, even if we're fighting COVID-19 this side, let us not forget other key issues that we need to fight, such as, HIV and AIDS. I must say that I think that the Zambian journalists are doing everything they can, to report about COVID-19.
Coronavirus restrictions have made a significant impact on the continent's most prominent economic sectors, agriculture and tourism. It's been even worse for people who depend on their day-to-day jobs. For Tony Senaya, an Accra, Ghana shoe manufacturer, the lockdown has brought zero sales for his business.
We get a lot of sales through social activities like weddings and parties. Yes, and for a very long period, about 6 weeks, we hadn't recorded sales, and simply because people were staying at home, and at that particular moment, nobody needed shoes to go anywhere. We have started manufacturing other leather products that are more intimate. So these are personal home items that we've started manufacturing of leather, just to keep the cash flow going until things become normal.
The UN estimates that nearly 30 million people or more could fall into poverty, and the numbers of acutely food insecure people could significantly increase. Paul Ndiho, VOA News, Washington.
Thank you, Paul, for a great report. And now it is my pleasure to introduce our guests, who are all joining us remotely in the interest of physical distancing. Let's start in East Africa, where we have Dr. Ahmed Okwel Ouma, Deputy Director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Dr. Ouma joins us from Addis Ababa, Ethiopia. Now to South Africa with Dr. Karesha Abdul Karim. Dr. Abdul Karim is a professor in clinical epidemiology at Columbia University and Associate Scientific Director of CAPRISA, the Center for AIDS Program of Research in South Africa. From the West African country of Burkina Faso, we are joined by Jeremy Zungrana, a public health expert and country director for JPIGO, an international nonprofit health organization affiliated with Johns Hopkins University. And also joining us today from Bethesda, Maryland, outside Washington, D.C., is Aaron Bietru, managing director for the Center for Financial Markets at the Milken Institute. A warm welcome to all of you.
Thank you.
Let me start with you, Dr. Zungrana, and I want to have an idea of what all of you think about this pandemic. First, Dr. Zungrana, could you assess the COVID-19 pandemic in Africa, and what do you see as one of the major impacts?
Thank you so much for giving us opportunity to join this call. I think, as you can see in Africa, the prevision was currently that we'll be living in a very catastrophic situation, but likely what we are observing is not exactly that number. We are seeing that even though we are observing in terms of increases of the positive cases, we are seeing a kind of reduction in the lethality rate. That means the number of people dying from COVID is reducing.
Okay.
A kind of control at this level. And if I take the case of Burkina Faso, Ouagadougou, where I am living, so far since May 25th, there is no single death from COVID. And we are seeing a kind of slow increase in terms of new cases.
Absolutely, so and this is something we see in continental, and we'll go back to find out more. Let me go to Dr. Karesha. Lockdown measures are being relaxed further in South Africa, even though coronavirus cases are on the increase. What do you think? How do you assess the state of the pandemic in the country?
Thanks very much. So we responded, like many other African countries, at a very early stage of the epidemic. In other words, when we had a few cases from travelers and contacts and hospital workers who'd come into contact with them. So it was before we started to see community spread. Now, because we're dealing with a new virus, the virus is going to continue to spread. The national lockdown helped to slow down the spread, gave us some time to prepare the health facilities for the potential cases that we will be seeing as the virus continues to spread. With the easing of the lockdown, we will anticipate to see an increase in cases, and what we will see is the spread of the virus in communities and in settings where we have very low adherence and implementation of the non-pharmaceutical interventions. Okay. But for most of Africa, we've not reached the exponential growth phase. We've slowed spread, but we have not stopped the spread of the virus. Thank you.
And that's a critical point there. We'll come back to that. Now to you, Aaron Bietru. The coronavirus health crisis quickly became an economic crisis. What is your assessment of the impact of COVID-19 on African economies?
Well, thank you for having me, and thank you for continuing to spotlight the continent on this crisis. I guess the critical thing is in dealing with kind of the economic side of it, we still need to start with the beginning of making sure that there's a bit of a relief on stopping the decline. And there are essentially commercial activities that have been helping on the health front to stop that decline. The launch just recently in terms of the medical supplies platform that was launched that Strife of Econefing in particular has been spearheading, but essentially using an online platform to accelerate the access to the essential medical supplies, the PPE equipment and the testing strips. And the fact that they are starting to roll out in a regional way is a great start that actually can lay the groundwork for other different things. And that's the second step of this, essentially, how do we restore some of these economies to pre-COVID levels? And you see a number of countries stepping up to try to provide relief when it comes to direct cash transfers in places like in Sudan, but also in terms of propping up lending facilities to help small businesses. But I think the true measure is how do we revitalize these economies, because we want to build back better, if you will, because we're starting to see the economies slide, negative to 3%, 6%, and in some places even bigger. But there's going to be a part of this that we need to make sure it gets to the key industries.
Absolutely, and we'll talk more about that. Now to you, Dr. Ouma. It took 3 months in Africa to reach 100,000 cases of the coronavirus. Now, in less than 20 days, in 19 days, really, the number doubled. So the WHO is sounding the alarm on the increase of cases on the continent. Is there a cause for concern here? What is your take?
Thank you for having me. No doubt that our situation in terms of numbers will get worse before it gets better. And in the natural way that viruses are transmitted in a community, we expect that the numbers will be able to rise quite rapidly after some days. We are probably in the mid-morning of our epidemic, and the peak has not yet reached, so we expect the numbers will go up. Our intention and plan and strategy is to keep the numbers low and the critically ill to minimal numbers, so that our health systems can be able to accommodate them. So there is cause for concern, but we have the strategies in place, and we are working with our member states to ensure that they are implementing the public health measures that will keep the numbers low.
Okay, and we'll hear more about these strategies. Now, our viewers have sent in some questions. The first one is from Asmele Tome. Let's take a look.
Another notion is that COVID doesn't affect the young as much. Is it because they have sounder immunity, or there is another scientific explanation?
Professor Carissa, let me toss this question to you. COVID doesn't affect children as much. What do we know about COVID-19 and its effect on children?
So what we know about COVID-19 is that the majority of people who get infected are largely asymptomatic, so about 80%. And then you have a small proportion who present with some mild symptoms, and a much smaller proportion who present with severe disease and require hospitalization. And it's absolutely correct. With children, the majority, I would say more than 99%, present asymptomatic or with very mild symptoms. Now, what we see in terms of deaths, both in Africa and outside Africa, is that it tends to be higher amongst people who are older, over 60, but also we're seeing people like in their 30s and 40s, if they have comorbidities or chronic conditions, that we see more likely hospital admissions and also more deaths than we've seen in other countries. In Africa, we're typically dealing with a much younger population. About 65% of our population is under 35. But we also have a concomitant epidemic of TB and HIV. So it's going to be very interesting. Other countries that have seen the epidemic peak and seen declines have not had the TB, HIV epidemics that we have. So this combination of non-communicable diseases with our high burden of communicable diseases, it's going to be very interesting to see how things unfold in Africa because of these unique configurations demographically and also in terms of disease burden patterns.
Okay. And Dr. Ogwal, you mentioned earlier measures that the Africa CDC are putting in place. When we look at children going back to school now, when the pandemic is still ongoing, what types of measures are put in place to protect them, to ensure that they go back to school safely?
What needs to be done with the opening of schools and children going back to school is physical distancing measures must be put in place. Hand washing facilities must be put in place, as well as appropriate information so that they wear their masks, and those who are even marginally ill will then stay home and not be amongst the school population. So the health system and the surveillance system needs to be up and running and really sensitive to any small adjustments in the students' health status, so that anyone that may have been exposed is quickly picked out and isolated, and therefore the rest of the student community is protected.
Okay, and as we mentioned earlier, the impact of COVID-19 is undeniable and quite diverse. Here are some of our viewers' comments on the subject. William Yel Akwok in South Sudan writes, "My country is in need of food assistance because 90% of our population is food insecure." Gerson Halukeni Kafine in Namibia says, "We need more testing." And Andrews Asare Noble in Ghana writes, "We need more isolation centers." So Aaron Betru, let me come to you. Food insecurity is definitely one of the impacts. Can you speak on what can be done on this front?
No, you're spot on. Essentially, when you have a national lockdown and where supply chains are kind of unraveling across the continent, it becomes almost impossible to get product from farm to market to a person's table in a more commercial sense. And in places where they're definitely more vulnerable frontier markets, that becomes even more compounded. Yes, there are efforts where international donors are stepping up to provide some of this assistance, but essentially this is a place for local economies to really be leaning in to source as much as possible from the existing agriculture. The last thing that you want to do is worsen the economic crisis by completely removing the local supply chain with an international aid architecture that it's individuals that are in the rural regions, perhaps less susceptible to contracting this given the distance, end up having a worse economic outcome. And so we need to make sure at the national level and regional level to source as much as possible from local manufacturing.
Okay, and Dr. Zungrana, I would like your reaction on the comment about more isolation centers needed. What can you tell us in terms of addressing this issue?
Of course, I think we mentioned that we need to learn how to live with COVID because this is not something that we are seeing will end soon. So isolating is probably not the most important thing to consider here. We have to observe all the social distancing and other measures that have been recommended. Isolation will be applying to those who will be tested positive, of course, until treatment or clearance is done. But I think what we need here is for people first maybe to get more testing and then start applying measures that can prevent them from spreading it at the community level. We also know that when we will get the border open, we will get more cases, and I'm not sure how we are going to manage it. If our health facility currently are able to host such number of people, knowing that all cases are asymptomatic and mild complication, they may be treated from home. And as I mentioned, we may need to learn how to live with the COVID from home.
Okay. Dr. Ouma, speaking of testing, which is very important in lowering community transmission and even containing the pandemic as a whole, can you talk to us about what Africa CDC is doing in terms of ensuring that there is enough testing in member countries? Because that has been one of the challenges. How many tests are conducted on average?
In fact, one of our key strategies is to expand testing in Africa. And our initiative for partnerships to accelerate COVID-19 testing has a target of testing 10 million Africans by the end of October. And we are well on that path. We are doing just above 3 million right now. To expand testing properly, we need to make sure that the infrastructure at country level is decentralized from the capital cities into the regional health facilities so that more and more people have access to testing facilities. Secondly, is to make sure that we have test kits available. These have become more and more difficult to find because everywhere in the world, everyone is looking for the test kits. But as Africa CDC, we are doing everything we can to make those available to member states. Third is we must do targeted testing, not to test everyone, not mass testing per se, but it is to target your testing so that every test is counting. That way we'll be able to get more who are affected, and using the ones that have been testing positive, we can be able to trace their contacts and test those ones as well. So it needs to be very well structured in terms of a strategy so that we test those who need it and not just test everybody. Finally, is we released recently guidance on use of rapid tests. And these we are using for surveillance so that we can be able to have even more targeted testing for PCR in the laboratory. These are some of the things that we are doing as Africa CDC to expand testing in Africa, because that's the only way we'll be able to know our exact burden and therefore prepare appropriately.
Okay, fantastic. Now, Professor Karesha, what criteria are being used to determine the peak? We say that Africa has not reached its peak yet. Is there a threshold to determine that? And does it depend from one country to another? Does it differ? Or will we look at it on the continental level?
Yeah, so the peak is not something that's static or predefined. And it really depends on a number of factors. But one of the ways that we look at it is when you start to monitor your cases. And if I may just add one point quickly, that in a lot of countries, testing started and they count when people are being admitted to hospitals. When you start testing at that point, it's starting testing a little bit too late. So if you want to do testing to prevent infections, you have to balance that with active case finding, which means you have to go into the communities and find the cases. And as was mentioned, we have one challenge, which is having enough test kits and enough capacity to test. But what we also have is regions in the continent where we have populations living at very high densities, like slum areas and informal settlements, where things like social distancing within the household and within the community is not quite possible. So that would be an area, for example, where if you have an introduction of the virus, you will have very rapid spread. And we've seen that in South Africa, for example, in the Western Cape province, that accounts for more than 60% of the infections in South Africa, is there are parts of your community that are more vulnerable than others. So once you have an introduction in the community, you have rapid spread. Okay. So to go back to your question, it's a point where you start to see some kind of plateauing in the number of infections, and then so that would be your peak where you're not getting more infections, and then after a while you will start to see declines.
Okay, makes sense actually. Makes sense actually.
So you can imagine like a bell-shaped curve.
Yeah, so it goes like this, of course. Thank you. Now, Aaron Betru, could you briefly talk about the difference between the short-term and long-term needs that folks should consider really when you look at the impact of COVID-19 on the economic briefly? Could you explain to us in terms of the challenges and perhaps some solutions?
Sure. And I spoke to this briefly earlier in terms of, on the short-term part, it's if you've got a crisis where we've shut down big swaths of our economy just by virtue of creating this social distancing that it slows down commerce, you have to give people the confidence that their health is going to be protected. So the health relief in stopping the decline, that's just completely job number one. And then on the longer term issues, it's thinking about how to reignite those economies, but making sure that you do it in a way that it's more resilient than when we started this whole crisis. And so I mentioned earlier that, the medical supplies platform, and one of the things that I thought was a brilliant thing was even though we had a number of countries that were insecure in being able to find the supplies that they needed, there's a plan of making sure to source as much of what is the supplies through local manufacturers, such that the economic benefit of the extra spending that's happening due to medical supplies comes back and is recycled to local African economies. And I would say those type of things are going to be important as we look further, because the trends that we're seeing across the board, it's making sure that we revitalize or maintain as much as possible the foundational elements of African economies, because like the crisis in 2012 and 2015 with Ebola, hopefully there will be an end. And we want to make sure that after coronavirus is dissipated, this crisis, we have a foundation to be able to reignite the economies and be able to have life in various communities.
Absolutely, and we'll continue our discussion shortly. We have to take a break. First, COVID-19 is affecting many people in many ways, as you know. Here are some of their stories in their own voices. Take a look.
Our job was impacted because people were suspicious. People didn't really want to do their hair because of the disease, and they were afraid of hygiene. Perhaps the hairdresser does not take appropriate precautions. Maybe he does not disinfect his tools. They are right to be worried. Before, we used to make very good money. Before, you could make maybe 5,000, 10,000. But now it doesn't work. There is nothing. You can go home with nothing, not even 100 francs, because people aren't coming. It's really difficult.
The headache was terrible. It doesn't even wear off after I took a painkiller. I drink a lot of liquid, especially tea. I used ginger and garlic too. Fortunately, God has helped me, and I had no breathing problem except for coughing and the headache. I was breathing fine. So as much as I can, I isolated myself. I listened to what the doctors told me to do and did as they told me to. However, I was scared for my daughter because we share a bathroom. How do I know if she is infected and does not know it?
Of course, that is the pivot of my job as a med lab scientist, adhering to standard operating procedure. Though I fear risking my family, definitely someone must do the job. I urge colleagues to be up and doing. Let's join hands together and fight this deadly monster called COVID-19.
Welcome back. You are watching a special edition of Straight Talk Africa on the socioeconomic impact of COVID-19 and the way forward. Our guests are Dr. Karesha Abdul-Karim, Associate Scientific Director of CAPRISA, Center for the AIDS Program of Research in South Africa. Dr. Ahmed Ogwel Uma is Deputy Director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Jeremy Zungrana is country director of JPIGO, Burkina Faso, and Aaron Betrou is managing director of the Center for Financial Markets with Milken Institute. Professor Karesha, I wanted to come to you first and have your reaction. We heard during the break these different voices on COVID-19. There was a mother that was infected and she was concerned for her daughter. Would you speak to the fact that when people are sick and they're home, being treated home, how should they properly protect their loved ones?
Yeah, this is a very important issue, as I mentioned earlier, about the living conditions for many people in Africa is quite constrained in terms of a number of people within a household, and also where we have women who are the main healthcare providers on the continent, in addition to being first responders. So beyond healthcare work, things like cashiers at supermarkets and shopping malls and so on. And this has caused immense challenges and is very troubling for women who have families, and when they come back, will they be infecting them and so on. So one of the calls, which is, can there be other isolation facilities? And it may sound like a bit of a luxury, but I think in homes where many people and the possibility of self-isolation is not possible, I think government interventions for those facilities are important. But at the end of the day, I think the things we have in our hands is what we know, which is about frequent hand sanitizing the surfaces and environments we're living and working in. It's about the social distancing as far as it's possible. It's about the use of masks on a regular basis. And those things are things that will help us to minimize spread and not only protect ourselves, but protect people who are close and near to us in the workplace or at home.
Okay. And Dr. Umar, one of the voices was speaking on protection for healthcare workers. What is being done to help healthcare workers on the continent? We've seen that this pandemic has really affected many of them who even lost their lives.
We are doing three key things in as far as protecting healthcare workers on the continent is concerned. First is building their knowledge on how to handle a highly infectious disease like COVID-19. And that we are doing directly, and we are doing it online. We're using every possible means to ensure that the healthcare workers' capacity is built in as far as protecting themselves is concerned. Second is we are providing them with appropriate personal protective equipment. And these we are sourcing wherever we source globally, and we are making them available at country level. And many countries are now starting to do local production and making the personal protective equipment even more easily available. Finally is to ensure that we are advising governments to separate regular health services from COVID-related health services. And this is important so that we do not have other health services being affected because people are either afraid to go to the health facility or indeed healthcare workers are afraid to work in an environment where there is COVID-19. So if you separate the facilities, then you can be able to manage the issues of infection prevention and control much more easily. Of the many things we are doing, some of the three key things to try and reduce spread amongst healthcare workers and keep our health systems running, because we have very few of those healthcare workers.
Okay. And Aaron, Africa's economic growth is projected to fall very drastically. And this is going to be the first recession in the region for the past 25 years. GDP is expected to fall between 3 to 8%, according to some projection. Now, we see that small and medium businesses will be dramatically affected, and it's difficult for them to recover from this. So what can be done to help SMBs?
Well, you bring up a good point. So essentially, it's a bit of a twin set of issues. You have not only the COVID crisis that is locking down small, medium enterprises, where you need to have at the national level a number of relief packages, essentially whether it be direct or through financial institutions. But the other side of this is pre-COVID, we had a slide in the price of oil. So a lot of oil exporting economies that were experiencing a price slump that really caused a question mark for large foreign direct investment from big organizations to say the new price really is not going to work. So we were having these two things converge at the exact same time. And I think a big part of thinking about, well, what does this mean for economic opportunity in a lot of different countries, is to think of other ways of shifting the economies, whether it be in the understanding that Western markets are going to be thinking about their own local economies and repatriating supply chains for some light manufacturing. That means some of the places that were anticipating that globalization would have brought that light manufacturing capacity into the country where they would have had jobs, that's going to shift, where we need to ask ourselves, domestic consumption of some of those goods needs to be a key target place in regional economies in particular. And so we're going to find, especially around the renewable energy space, areas. And so, the Ethiopian Renaissance Dam in particular, we've got to make sure those type of revenue share efforts in the region stand up and they help prop up the productivity that's necessary.
All right, thank you, Aaron. So, Dr. Zungrana, let me come to you. What about the impact of COVID-19 on other services? Dr. Uma mentioned it earlier. What is being done in Burkina Faso, or what can be done to help communities really care for themselves on other health issues and not be afraid of COVID?
Yeah, thank you so much. I have to reiterate that the impact of COVID on the health services was kind of huge, because at the beginning, the health provider was not well prepared. They fear taking care of client, and client also fear going to the health facility because this is where they believe they may get the disease there. So, and the users of client for these services like antenatal care services, malaria, TB, HIV/AIDS was dropped a little bit according to some study. But currently, we are seeing that the government is making effort to build the capacity of the provider, but also equip them with personal protective equipment. But the most important thing is sensitization, community sensitization, where religious leaders, community leaders, all partners, stakeholders, it's like a national level stakeholder mobilization for everyone to play its part for COVID tackling. So I think they are trying to bring a kind of reassurance for people to continue using health facilities, but also for providers to be more confident and skilled to tackle this disease.
Okay.
I think apart from,
Okay, great. Now let's go to our viewers' next question. Let's take a look.
We heard that there is no vaccination for this virus, but some people talk about herbal remedy. So my question is, could COVID-19 be cured with traditional herbal treatment?
Professor Karesha, COVID-19 and herbal treatment, we've seen the controversy around it. What is your take?
So we have a new virus where we don't have a vaccine and we don't have any cures. So we're starting to see some promising products coming through. This week we heard about, from the recovery trial, the use of dexamethasone. We've also seen that hydrochloroquine makes very little impact. So whatever is out there, people are looking at natural remedies, people are looking at drugs that may have been developed for other indications. But right now, they need to be evaluated before they can be used. So I would discourage people from just following what's in the news and in the internet as solutions, but watch the space in terms of good quality evidence, and based on that, utilize things. It's like every other new condition we have. There's always 100 people, if not more, with solutions.
Okay.
And people are so desperate, they will use it. And we need to be very cautious that we're using evidence-based interventions that we know work both for prevention and treatment.
Okay. Also, one of our Facebook followers from the Democratic Republic of Congo wrote to us saying, they say plant extracts such as quinine and artemisia that are used in pharmaceutical drugs are effective in conventional drug. Why are doctors so quick to rebuke solutions suggested by traditional practitioners who use herbal medicine? Dr. Ouma, we've seen that with COVID organics, the Africa CDC very quickly raised awareness and said that people should be cautious. And there was a sense that this solution or this approach was not supported by the centers. What is your reaction?
Let's be clear. Africa CDC is very supportive of African therapies and possibilities for treatment. What we are also very clear about is that it must be evidence-based, it must be backed by very clear science, and it must be safe. If none of these have been proven, then we wouldn't be able to support that, because we don't want to be in a situation where we are providing support to therapies that may be able to cause harm. It must be safe and it must be efficacious. If it does not meet these two criteria, then as Africa CDC, we are not able to support it. Having said that, let me be clear that we support locally produced solutions to any type of problem, whether illness or otherwise. And there is every possibility that the next vaccine or the next therapy will be able to come from Africa. What we need to be careful about is safety and efficacy.
Okay. And speaking of efficacy, Dr. Jeremy Zungrana, Professor Karesha mentioned earlier hydroxychloroquine, saying that it has been proven not to be that effective. What is your take? There are doctors that are still using it on the continent. Doctors I've spoken to, whether it's in Burkina, in Cote d'Ivoire, in Algeria, they are still using this drug even after the WHO said that it was not effective. What is your take?
I think this is, I will say this was part of, for example, Burkina treatment protocol, and this is what they have been using. And it is coupled with observational study, and still now we don't have a result. But what I can say is, as I mentioned, since almost the beginning, since May 25th, we don't have a single case of death. I don't know if this is attributed to the use of the hydrochloroquine or other related impact. But of course, if WHO and other bodies are saying that there is a risk, probably they have the basis and evidence for that. But for many African countries that I know and following, they are still using it, and they seem to have a kind of good result, but we don't know to which entity, is it this drug or other thing that we can attribute to it. I think it will be very interesting to explore what is contributing for Africa to not have a lot of death. Is it linked to the use of the hydrochloroquine or associated with other factors? And this will be a subject of study rather than just blocking thing. I wish if we have other alternative to propose to countries, they are ready to take on evidence-based, as it has been always the case.
That'll be interesting to see, given that this is a drug that has been used for many, many years on the continent to treat malaria. Is it maybe because Africans are used to using it? I don't know, I'm just speculating. But let's go to another question from Feu Jean-Pierre, who is in Yaoundé, Cameroon, a salesman. Take a look.
I have a preoccupation. I lost my activities and my business, and I would like to know how the government can help me.
And Eran Betrou, the informal sector makes up for over 80% of employment in sub-Saharan Africa. That's according to the International Labour Organization. So how can the informal sector be provided help, especially when we know that it's so difficult to track them?
Yeah, I mean, this is a problem not just on the continent, but kind of around the world, and even in the U.S. I believe African-American-owned businesses, 94% of them are sole proprietors. So in this context, there are a range of different activities, whether it be, direct cash transfers in some places, but actually thinking about, well, what is the need that a number of these stakeholders have? A number of these individuals, it's being able to have the funds necessary to stay indoors, not have the ability to earn money, but provide the food that they need for their families and friends. And so direct relief for those individuals matters. But then recognizing that a couple of these, they're part of what I would call kind of, the first line response that's necessary to sustain the larger community. And so there are certain industries on the West African side that are taking recycling of plastics and melting them down and making new face guards. And they are essentially employing a number of informal collectors of recyclable goods to be able to have the supplies necessary to produce these goods that are then sold to the hospitals in the area. And so I look to the providers of capital, and I mean some of the loan funds that are focusing on the continent, to some of the microfinance institutions that are trying to figure out how to continue with their mission of providing access to capital, but also make sure that they're not unduly drawing themselves into a very risky lending that's happening. And here is where, at the national level, as well as philanthropy, can play a part in making sure that these conduits, these microfinance institutions, are well capitalized with both the liquidity that they need, but the guarantee in terms of their balance sheet to provide the financial assistance that some of these informal economy folks that are running around selling the essential items, foodware, as well as other things. So that's a critical part of making sure that they maintain that.
Okay. And I wanted us to talk about the way forward. What are some of the steps that we will take? And I want us to take a look at a short clip that we have from the former president of Mauritius. She spoke on the successes of Mauritius, at least what were some of the steps that were taken for the country to be seen as one of a success stories when it comes to fighting COVID. Let's take a look.
I think, we just adhered to what has been prescribed internationally when the first cases were detected early March. And there has been lockdown of the airspace, and the people coming in, they were quarantined. And because we have a free healthcare, so access to medicine was not an issue. And so we have adhered to the best practices all along. And people also have been quite disciplined, I must say. And when people have not listened to it, I think the police has been there to actually ensure law and order and make sure that the guidelines were respected. So it was a kind of triangular kind of approach, and it was very much the carrot and the stick approach.
Dr. Ouma, the carrot and the stick approach in Mauritius, what is your take on what worked in Mauritius? What can we learn from the country?
I think the former president has explained very well what they have done and what has worked for Mauritius. The fact that it is an island makes it a lot easier to control the borders. The rest of Africa is a bit different, particularly the countries on the mainland. And some of the things that need to be done is personal discipline. I like saying that we are the vaccine. It is what we do that is going to interrupt the transmission. Second, in terms of the next steps, we must strengthen our health systems, and not just hospitals and infrastructure, but also the numbers and the capacity of the healthcare workers need to be improved so that we are ready for the next pandemic when it comes. And finally, we must be able to provide correct and timely information to members of the public. That way they know what they need to do, when they need to do it, and that discipline is what is going to ensure that we can be able to tackle any type of illness that will be seen within the population. Personal discipline and improving the health system through infrastructure and capacity building for health workers.
Okay, and Dr. Karesha, from an epidemist perspective, moving forward, what do you see as some of the priorities or maybe some of your concerns?
So I think we all have to learn to live with the virus, and we have to be able to balance the public health imperatives in terms of slowing down the spread of the virus with protecting livelihoods and also respecting the rights of individuals. And I think we've seen a lot of police brutality in some of our countries, and we have to address that as we think about saving lives and saving livelihoods. But the key issue, I think, is what we just heard, which is that we have to move away from anxiety. And I think a lot of the early images was about deaths. And so as we ease the lockdown and return to the to being active citizens in whatever form and shape that takes, we have to take the measures, the non-pharmaceutical interventions, the social distancing, the hand sanitization, etc., that we've heard about, mask using, because that's the thing that's going to help us and give us agency during this period of anxiety.
Okay, and Dr. Jeremy Zungrana, what social safety nets can help mitigate the pandemic as we move forward? Are we yet to see the worst case, or what can we do to avoid it?
I think one thing that I realized and COVID is teaching us is this is a multi-sectorial approach that we need to consider and shouldn't be only a matter of Minister of Health as it used to be. Everyone needs to be involved and to be part of it so that they can educate the people, because the perception that they will be giving to the COVID impact on the behavior of people, not only in terms of respecting instruction, but also committing to support or invest on what need to do. I have to say that COVID mentioned and show us that if you have a poor health system, you may end up being a client of this poor health system. So we should get prepared and get ready at any time.
Okay, and Aaron Betru, quickly, could you speak briefly about some of the shifty sands and global trends that can help or might help the recovery process? And also, what do people consider is the global capital markets can play during this crisis? What role can that play? Quickly.
Yeah, sure. No, I think a big part of this on the capital market side is we saw at the beginning of this year a lot of investors pull out of emerging markets for fear of what was going to be an anticipated decline. And as a result, a lot pulled out of Africa. But when you look at the projected declines globally, the contribution that Africa's decline has on the global decline is actually much less so than the other regions. So in terms of resilience on the economy front, Africa so far isn't as hard hit as other areas, knocking on wood. Hopefully that this maintains. And so you have a number of investors sitting on a lot of liquidity, and they may be coming back in as they see the results of what are the efforts of the African CDC and others to kind of slow down the process. So that's one thing. And then on the second side, you've got a number of debt obligations at the country level. And sure enough, whether it be efforts by the IMF and other G20 countries to reduce the debt burden on African countries, we have to make sure that some of these processes are quite transparent. And what I mean by that is there's been reports essentially of whether it's bilateral activity of Chinese and African nations in terms of how those things are negotiated. The last thing that we want is at the end of this crisis to find out that these countries, due to the debt obligations, and there's quite a bit of Chinese debt in African countries, that they're made even more vulnerable. So transparency in that process is critical. And the third thing that I'll mention is the last large global recession that occurred was due to the 2008 financial crisis. And as a result of that, the Basel Committee created a number of macroprudential risk management financial regulations. And now I think going forward, we need to look back at those and tweak some of those regulations to encourage investment to come back into emerging markets, because we need that growth more than ever. And investors around the areas around, especially ESG related, should be encouraged, because this is the time to make sure that those economies grow back, but grow back better.
Okay, so much to talk about on the economic front, and we'll come back to that. Now, Dr. Ogwell-Uma, to you, Africa CDC's priorities moving forward. What should we look forward to?
Several things. First is building our continental capacity for disease intelligence, for local production of the equipment and supplies that we need, and for improving the capacity of our health workers and our health systems to be able to handle whatever disease condition may be able to come. Second is to get commitments from the highest levels of policy making that a new public health order is required for Africa to be able to adequately tackle any outbreaks that may be able to come in the future. And third is for members of the public to see themselves as part of the health system. That way, whenever there is need for them to act in certain ways that are public health appropriate, then they do so. And that way we can be able to bring to a close any sort of outbreak relatively quickly.
Fantastic, and thank you so much. Are you hopeful that we will not see the dramatic prediction that we've heard from experts that Africa will be the next epicenter catastrophe very quickly?
Africa is already showing them that there is no catastrophic numbers. Good things do come out of Africa, and COVID-19 is proving that. We are very happy with what we are seeing.
Okay, great, Dr. Uma, thank you so much. And the final word to you, Professor Karesha. This epidemic, can we talk about the aftermath? Is it too ambitious? Because there's so much that we still don't know.
That's true, but I do think that there are some amazing opportunities that come up, and I wanted to flag a few things that that relate to gender in particular and young women. And so the first, before I move to the gender issue, is that Africa has to lead some of the innovations in terms of diagnostic kits and tests, in terms of vaccines, in terms of new therapeutics, because all brand new, we're all learning, and this is the first opportunity we have to not just be recipients and imbibe what comes from somewhere else, but to actually be part of the solution. The second is that, as has been mentioned many times, that Africa has a very large informal sector. It's all women-headed and women-driven, and it's also young women. So we do need to look at some of the values we place on women in society. And I want to use again a South African example where gender-based violence has skyrocketed. And we really need to use the opportunity as we're dealing with COVID-19 to address that. And I'd say, lastly, we have a lot more agency than I think we give ourselves credit for.
Okay.
Thank you.
Thank you so much. We have to leave it there. Professor Karesha Abdul-Karim, Dr. Ahmed Ogwell-Uma, Dr. Jeremy Zungrana, and Aaron Bethru, thank you so much for appearing on Straight Talk Africa. We appreciate your time. And thanks to all of you for watching, listening, and participating with your questions and comments. I'm Linor Moudou. Until next time, stay safe, wash your hands, and strive to make every day a healthy day.